the top 8 nutritional deficiencies in peripheral neuropathy. Are you struggling with pain, burning, numbness? Do your feet cramp? Is the first step in the morning brutally uncomfortable? Are you having trouble sleeping at night because your feet are either so hot you want to ice them, or are they freezing, or are they in so much pain that you don't even want the covers touching them? If you have these problems, then you need to pay attention, because in this video, we're going to talk about the top 8 nutritional deficiencies and how they affect the nerve health, which affects your neuropathy symptoms. But not only we're going to talk about these top 8 nutritional deficiencies, I'm going to give you some suggestions on changing your diet and include foods that can help your body heal. I want to make sure that you watch this video to the entire end, because sometimes it's one point. Isn't that always just one point that if you miss, it could totally slow down the healing process of neuropathy? So make sure you watch everything to the end. I'm Dr. Gregory Kramer. I'm a Livonia, Michigan chiropractor. I'm in practice for over 33 years, and I specialize in helping people with chronic health problems just like you. I specialize in treating peripheral neuropathy, spinal herniation, spinal bulges, chronic knee problems, chronic foot. These are many problems that I myself have had, and as I learn about how I can help myself, I share that information with you. Now, before we go on, please like and share this video to someone in need. Also, everything we do is to help your body heal itself. So if you would like to eliminate pain as fast as possible, avoid drugs and surgery so that you can stabilize your body so you live stronger, longer, follow me on these other videos that I produce. The symptoms of peripheral neuropathy: persistent pain, burning, numbness, tingling in your hands and feet. So let's start with your hands. So now you've got numbness and burning. Imagine going into your pocket and you can't get the correct change. That's going to feel very odd and make you feel very old. Imagine trying to use your keys to start your car, enter your house or your office, and you fumble with that. That's not a good feeling. Imagine trying to drive or type or use a calculator or use your cell phone. How scary would that be when you're trying to call someone you love? Imagine calling your spouse, calling your children, or God forbid, calling 911 and you have trouble dialing the phone. That's what peripheral neuropathy can do to your hands and feet. Now, if it's in your feet, burning, numbness, you have weird sensation in your feet. Well, the first thing you notice is your feet are more sore. So at the beginning stages, you're going to notice your feet are sore. Like, what's wrong with my feet? As it progresses, you're going to start not only have sore feet, they're going to get more painful, okay? And you're thinking, what is wrong? What shoes do I need? And then you start getting burning at sometimes, and now you might get your feet are freezing. And if your feet are getting uncomfortable at night, now you can't sleep. That leads to chronic fatigue. So you now have another problem. And one of the problems is people cannot feel their feet properly. They have trouble stepping over objects. So now they have increased risk of falling. Falling is one of the #1 causes of death over the age 50. So this is terrible. Now, in my previous videos, we talked a little bit of our unique treatment approach where we look at you structurally, neurologically, and metabolically. There's no drugs, no surgery in our approach. We want to help your body heal itself. We look at you like a plant that's not thriving. We want to give things to the plant to help it regenerate. So we look at you structurally, neurologically, and metabolically. Now, today we're going to talk a little bit metabolically, or the 8 nutritional deficiencies. Now, why are we doing this? Because when you eat junk food, you create inflammation. And chronic inflammation over time can damage the nerves. And when we eat junk, we're getting nutritional deficiencies. So our nerves, our tiny nerves, need certain nutrients to heal. So we've got chronic inflammation, nutritional deficiency, that leads to poor quality healing of the nerves that actually can injure and the myelin sheath, which is the protective coating of that nerve. And as that protective coating wears off, that nerve loses the ability to talk to your brain. Now, that could be lack of sensation. Now you don't feel things. It could be more pain when you shouldn't have it. Your feet are cold, they're hot, they're numb, they're burning. It's just not comfortable. Our whole focus today is on eating a high-quality diet. And guess what? Most of you already know that. You know you need more fruits and vegetables, okay? Real food, food that has not been processed, okay? So almost every answer, almost every deficiency is going to be clean meat. If you can afford organic, grass-fed, that's great. If you can't, don't worry about it. Lots of fruits and vegetables, nuts and seeds, and that covers all these. So I'm going to go through each individual nutritional deficiency and certain foods to focus on. But in general, fruits and vegetables, nuts and seeds, fish, chicken, beef, and cold water fatty fish. So let's talk about the first one. Let's talk about vitamin B12 or COBALAMIN. Now, this is an interesting one, okay? This can lead to numbness, weakness, balance problems. And the challenge with vitamin B12 is that you really need animal products. That's the tough thing. Fish, chicken, beef, liver, okay? The problem is if you are a vegetarian, how do I get it? Well, you can get some for some types of plant-based fermented foods. Natto is one source. Tempeh is another. You can get small amounts and fortified foods. So again, it's a challenge if you're a true vegan, but that's your best opportunity. So fortified foods, natto, tempeh. But for those that are not vegans, lean meat, fish, chicken, eggs, beef, liver, things like that do a great job. Now, our second vitamin deficiency is vitamin D, especially if you live in cold weather. So we get vitamin D particularly from the sun and cold water fish. So again, we're back to a cold water fish, wild Alaskan salmon. Now, yes, you can take supplements, but it's a great place to start is try to get real food. And if you don't like a certain food, one of the best ways to increase your taste buds is you got to be a little hungry, okay? And when you're hungry, you'll taste the sugar out of a carrot, all right? So that's the best way. If you want to increase, I need to learn how to like salmon, so eat it when you're hungry. There's a variety of ways you can prepare it, but you want to get wild Alaskan salmon if you can afford it, and you can cook it with, real simple. Throw it on a frying pan with lemon and butter. It's fantastic. It's simple, but you want to get some wild Alaskan salmon into your diet. Our next nutritional deficiency is vitamin E. Again, what are we back to? Nuts and seeds, leafy green vegetables. We're also looking at egg yolks, and again, vitamin E deficiency. What are we talking about? Nerve damage, neuropathy, loss of reflexes. So what are we talking? Nuts and seeds, green leafy vegetables. So we're back to what we've already kind of knew. Magnesium. Now, many people associate with magnesium, too much or too little can lead to bowel problems. It can lead to neuropathy symptoms. It can lead to muscle cramps. So again, we want fruits and vegetables. So what are we looking at? Nuts, seeds, legumes, green leafy vegetables in your diet. So we see a common theme here. Essential fatty acids, we're back to fish, okay? And again, we really want to make sure that wild Alaskan salmon is the best source of the omega-3s. We want to support nerve health, flax seeds, chia seeds, walnuts. Those are another source of essential fats that we want in our diet. Vitamin B1 or thiamine. If you're deficient in that, you're looking at maybe berry. Now, again, we're looking at confusion, memory, neuropathy. So we got some legumes and some nuts and seeds again. So we got B6, pyridoxine deficiency. So again, what are we looking at? Fish, organs, okay, in your diet. So again, meat, fish, steak, chicken, fruits, vegetables, nuts, and seeds kind of takes care of everything. Folate or vitamin B9, that's another problem we can have with the nerve. So megaloblastic anemia, shortness of breath, poor growth. What are we going for? Green vegetables, citrus fruits, liver. So as you can see, there's a common theme. And yes, liver, a lot of people, if you can get liver from a healthy animal, that is like a multivitamin. So again, these nutritional deficiencies can contribute to a host of symptoms. So we've talked about it in the past of trying to get your weight down, eliminating grain and sugar, making sure you're getting fruits and vegetables, making sure you're getting fish, chicken, eggs in your diet. Those are things that you can do to help your body heal itself. Now, I want to hear from you, all right? What have you been doing? What have you done to try to help yourself with neuropathy? Have you tried changing your diet? Have you had to have surgery? Have you tried a medical approach or taken certain drugs? Have you had shots? Have you had physical therapy? Have you used a rebuilder? Have you used an anodyne? Have you tried changing your diet? What have you done? I would like to know what have you done, so this is the time to share it. Now, If this information resonates with you, do me a favor, like it and share it. And so if you subscribe to my channel, I'll have more information of this nature. Our next video, we're going to talk about things that you can do to help yourself. So if you would like to learn more on how to help yourself, certain things that you could do at your home, how to help recover from neuropathy, go up to here and watch the next video. In fact, I would go watch that video right now.